Wade, and I'm a family nurse practitioner student at Auburn University. Some people are unaware of the education and certification it takes to become a nurse practitioner. This video will provide that information, the history of the nurse practitioner, and the role of the nurse practitioner in healthcare today. For the history of the nurse practitioner, in the 1960s, physicians were moving out of general practice and into specialties, which created a gap for patients in primary care and prevention services. And in 1965, the first nurse practitioner certificate program was established. In the 1980s, most states mandated graduate degrees for nurse practitioner practice. And in 1986, a study found that nurse practitioner provided care was equal to that of a physician. In 2003, U.S. healthcare institutions began to hire large numbers of nurse practitioners, and in 2005, numerous studies provided evidence of the value and quality of nurse practitioner-provided healthcare. In 2010, the Affordable Care Act, signed into law by President Obama, supported nurse practitioner practice to provide affordable health care to all patients. And in 2010, a report from the Institute of Medicine stated that nurse practitioners should practice to the full extent of their training and be full partners with physicians and other healthcare providers. Therefore, for over 50 years, the nurse practitioner profession has been involved in providing healthcare to the public. The required education for nurse practitioners is a Master of Science in Nursing degree or a Doctor of Nursing Practice degree. Therefore, nurse practitioners must hold graduate degrees to practice. They have an advanced degree, more education beyond a registered nurse who holds a bachelor's degree. And all nurse practitioner education programs must be nationally accredited. Nurse practitioners also have to be certified by a national organization in order to practice. Organizations include the American Academy of Nurse Practitioners, known as the AANP, the American Association of Critical Care Nurses, the American Nurses Credentialing Center, the Pediatric Nursing Certification Board, and the National Certification Corporation for the Obstetric, Gynecologic, and Neonatal Nursing Specialties, with the ANCC and the AANP being the most commonly used and well-known among nurse practitioners because they offer family nurse practitioner certification. The certification must be renewed, usually every 5 years, but depending on the certifying organization. For the scope of practice for nurse practitioners, they can order, perform, and interpret labs and diagnostic tests, diagnose and treat acute and chronic health conditions, prescribe medications, and educate patients on disease prevention and health management. The scope of practice for nurse practitioners may vary depending on the location of practice. The scope of practice is governed by individual state nurse practice acts. Nurse practitioners can practice autonomously or in collaboration with a physician, dependent on the individual state's rules and regulations. The restrictions and regulations are shifting towards more autonomous practice for nurse practitioners. And there's an annual order from the nurse practitioner that provides legislative and regulatory advancements for all states. And also, the AANP provides an interactive map which provides information for nurse practitioner scope of practice in each state. And a link will be provided for the article on the nurse practitioner and the interactive map below this video. For prescriptive authority, nurse practitioners have prescriptive privileges in all 50 states. States may require additional certification and/or education for nurse practitioners to be able to prescribe scheduled drugs. And again, depending on state regulations, nurse practitioners may have to be in collaboration with physicians. Some of the scheduled drugs may include Dilaudid, Tylenol, Ambien, Tramadol, Xanax, Lyrica. And the nurse practitioner, the article, also provides prescriptive authority of a nurse practitioner for each individual state. Quality and cost effectiveness of nurse practitioner practice has also been researched. According to the AANP, the high quality and cost effectiveness of care provided by nurse practitioners have been reinforced by research and evaluations over 4 decades. Numerous studies, including the 2005 Cochrane Review and reports from the RAND Health Foundation and the National Governors Association, to just name a few, provided evidence of the value and quality of nurse practitioner provided services. According to another study, extensive evidence shows that in addition to providing a broad range of primary care services at a level of quality similar to physicians, nurse practitioners typically provide a greater level of care coordination and have higher patient satisfaction ratings. Many nurse practitioners also work in primary care for rural and underserved populations. According to the AANP, approximately 89% of nurse practitioners are prepared in primary care, and approximately 75% of nurse practitioners are actively providing primary care. Compared to other primary care disciplines, nurse practitioners are most likely to practice in rural communities. Primary care access can be increased for patients by increasing the number of primary care nurse practitioners. When compared to primary care physicians, primary care nurse practitioners are more likely to practice in rural areas and provide care to vulnerable populations. Therefore, nurse practitioners are more likely to be prepared in primary care and offer more preventative, holistic care to rural and underserved populations. So 5 main points to remember about the nurse practitioner. The scope of practice. Nurse practitioners can manage patients' overall care, including ordering, performing, and interpreting labs and diagnostic tests, diagnosing and treating acute and chronic health conditions, and prescribing medications. Nurse practitioners are also graduate educated. They must have a Master of Science degree in nursing or a Doctor of Nursing practice. Nurse practitioners must also be certified by a national organization to practice. The majority of nurse practitioners are certified in primary care and practice in primary care to offer preventative and holistic care. Many nurse practitioners provide care to rural areas and the underserved populations. Therefore, nurse practitioners can help fill in the shortage of primary care physicians with the growing and aging population. Thank you for watching this video. I hope it helps provide more information on the qualifications and the role of the nurse practitioner.